I was in Terrigal for the weekend in January, and I remember there being an emergency teleconference being pulled together at the ministry, and I was sort of sitting by the pool and listening to this teleconference, and I remember just the panic rising, going, okay, this sounds like it may not be another MERS or SARS, which we got through pretty easily. This sounds really serious.
The pandemic plan that was sort of in archives from Corrective Services could be summed up. Well, it was less than one A4 page. There was a senior executive meeting down in the Commissioner's office, Mr Severin's conference room, which I was tasked with delivering a short PowerPoint of potential impacts on, and it was very high level that, and pretty much touched on things like prisons are probably have got a high threat vector for transmission of these sort of diseases through their infrastructure. The underlying health conditions of inmates are typically poorer than those in the community, and then also as well the impact on the thousands of correctional officer staff that's required. From that meeting, it was pretty much decided that a command post would be stood up. There was a large group of people had to come together very quickly because there was no playbook. There was no contact tracing, hadn't been heard of, let alone how do you do it in a correctional environment? What are the potential impacts? You know, how does this impact on reception centres, releasing? So everything that we currently do, how do we do that with COVID? So again, so we set up daily situation reports where centres had to report in.
Yeah, look, this was in February, I guess, / March in 2020. Well, there really were crazy times in terms of early, that first quarter of 2020, where every government organisation, every private organisation, every individual was after their own stock and stockpile of PPE, whether it was masks or any number of other essential PPE equipment. So it was very difficult. So we were trying to source materials from, within New South Wales, outside of New South Wales to the rest of Australia, and then we very quickly went worldwide.
We moved offender reporting predominantly to phone reporting, and our staff largely worked from home. We rotated people through our offices in teams. So, for example, with a large office like Campbelltown, we had 4 teams, with 3 of those teams working from home, and 1 of those teams continuing to work from the office to provide essential services to the community. So for those individuals who couldn't be monitored via phone reporting, we still allowed them to come into the office. The other thing that we did during COVID is we made sure that we consulted and engaged with our people all the way along. COVID was very much an adaptive challenge for community corrections, and what we found is that we didn't have a rule book to follow. We really needed to consult with our people and engage with them all the way along, and through doing that, I think we came up with the best approach that worked for us.
We decided with the command centre, in addition to managing potential operational crises that emerged, that every bit of policy that we developed would be done in a very systematic manner, and that in developing the policies we'd do it in conjunction with Justice Health, with the New South Wales Public Health authorities, with other experts outside of that domain, and with the whole of the Corrective Services executive to socialise policy and to discuss it amongst the group before we put it out, and to ensure that every change we made was actually documented and managed in that way. We also had a very strong adherence to evidence, so we very quickly sought out evidence that was available in the international literature and didn't just rely upon being fed information from New South Wales Health, but satisfied ourselves and challenged thinking where that was appropriate to say, this approach seems to be evidence-based, this one isn't. The emerging evidence around testing or the nature of exposure and the importance of wearing PPE, all those sorts of things we tested ourselves independently in the literature. So I think that's what distinguished our approach.
I'm not sure that a corrective services organisation would be the one you would predict would be interested in mathematical modelling. And so there's some significant foresight in that engaging with some mathematical modellers to guide the public health control measures.
Yeah, I suppose, I commissioned the modelling, it was based on a view that I had, is that I suppose that from the outset there were multiple things that you could do to prevent the disease. Part of it would be involved locking every prisoner in their cell all the time and seeing nobody, with obvious consequences for their well-being and mental health and for the ability for the system to function. So trying to understand, of all of those available controls, which ones were the most efficacious.
There were outbreaks being reported in prison centres across the globe. Many which were really of substantive concern. Essentially, the great majority of the inmate population very rapidly becoming infected, and hospitalisations and deaths. So some of the things that we found very quickly using that model were that, as had already occurred overseas, left untouched with no control measures, outbreaks inevitable, essentially all of the prison population. So we modelled, for instance, a prison with of the order of 1,000 inmates, and found that at the peak of the epidemic, unabated, 600 per day were becoming infected. Of relevance to corrective and health services in the sector, we noted that there would be spread from inmates to staff, and that would impact on the available staffing capacity at the peak of the epidemic, with about a third of all staff members unable to attend because they'd become infected.
But yeah, I remember very well the morning that it kind of hit me as an executive that we were facing something that we hadn't faced before, and we had one staff member come in positive to our forensic high secure hospital, and it knocked out nearly a third of our staff in one go. And that morning we looked at our pandemic planning, and we looked at our disaster planning and went, that's not going to work as well as we thought it would be. You know, brilliant plans. And I think that was the same for everybody, not just for Justice Health, for the whole of health, and in fact, I think for the world. The now Commissioner, Mr. Cochrane, was the Assistant Commissioner of Operations, and we had many a late night phone call just going through what we're going to do. And we tried to develop a consistent and simple worst case scenario plan which would do us going forward.
So, you know, while we made certain decisions very quickly and some very good decisions very early on, such as closing down visits and making sure that we restricted the entry to our correctional centres, we were waiting for advice all the time. You know, we were waiting for advice on what the best PPE was, for example, when we needed to wear certain PPE. What were the environments where we had to make sure that we upped the level of protection for staff and inmates as well? What we had to do on escorts, how would we actually fulfil our commitments to the court in terms of appearances for inmates? Now, some of those decisions were made for us. Courts and others made the decisions to say no jury trials, we'll do everything by AVL. But it was all completely new. And we were learning as we went along.
Yeah, there are a whole range of things that you know, we didn't know about, and we were really worried about all sorts of things. I remember myself and the Executive Director of Justice Health did a series of, I guess, communiques with the inmates and the staff in every correctional centre around the state. You know, we were trying to Zoom in, or we were trying to have telephone calls, because the Zoom technology wasn't quite up to scratch back then. And, you know, we were telling them, oh, yeah, you have to, you know, wipe everything down and you'll catch it. It'll be on the rails there for 2 days and stuff. We just didn't know what the drill was. But, yeah, things like masks and things of that nature were, you know, at that stage, you know, not required in certain areas, but mostly staff, you know, understood the seriousness. But as you moved out from the metropolitan area, I think, you know, staff, you know, were thinking, well, this is just something that happens in Sydney. In Sydney, we won't have to worry about it. And so consequently, I think, you know, compliance with mask wearing out in, you know, in the regional areas was not as rigid as you would have in the metropolitan area. I remember going out to country correctional centres and people would be coming up and hugging me and, hey, you go, mate, you know. And I go, hold on, don't you know about this COVID thing?
Then what we had to do was start transporting people in a very different way. So there was a lot of work done to review the trucks, the air conditioning of the trucks, the flow between the back compartments, the front compartments. We had fleet working non-stop with specialists to make sure that everything we were doing was to mitigate risk as far as possible. You know, we were putting in new equipment in terms of the filters and that to make sure our staff were safe. For the SOG space, what we did, particularly in the early stages of COVID, we almost broke into those teams of A and B. We had our regional people. So we were ensuring we had a response capability regardless of if one person went positive. So we were minimising the amount of people the teams would have contact with.
In a highly unionised workforce like ours, I can't express how grateful we've been to the PSA for their incredible cooperation in almost every aspect of what we have to do, making hard decisions where they realised that there'd be consequences, and taking some leadership with their members, because quite understandably staff became distressed on numerous occasions about the impacts on themselves, concerns about the safety and well-being of their families. All those things are highly volatile, and with a union with a very strong focus on work health and safety, we could have seen the whole system locking down, but I think we got a very measured response.
Well, as you know, Wendy Hoey, the Executive Director of Justice Health, and myself were describing to all the inmates, look, this is a static cruise ship, because remember we just had that big cruise ship docking in Sydney Harbour and then disgorging everybody, you know, who all then got COVID, and unfortunately a lot of people died as a result of that one. So, you know, that's the sort of messaging we were trying to give people, that, yeah, look, once it gets in, you know, it will be hard to contain.
Given it was in its early days as well, it was a lot of uncertainty, so the officers were very stressed, the nursing staff were freaking out. The officers would come to the nurses for guidance and support, and vice versa, but the advice kept changing, and that's what caused the hysteria. I know in the very, very early stages, to ease the hysteria, because it wasn't just the staff that were freaking out, it was the patients too, and obviously they're only seeing the media, but obviously being a setting where we have a high risk of transmission, it was extremely nerve-wracking.
You know, I was talking to the guys in the command post, and we came up with an idea to build a field hospital, and you've probably seen that in, you know, as part of this. And you know, the fact that we were able to get funding for it, and it took 6 weeks to build the thing, and it was just unbelievable that we were able to pull that together in 6 weeks.
One of our nurse managers, he had experience in working with emergency crisis situations. So he actually developed the field hospital alongside with the command post and other key stakeholders. He engaged with some external hospitals as well to ensure that we were going to satisfy best practice. So in the initial phases, it was my understanding that the field hospital was actually going to be for if it became so unbearable that the external hospitals couldn't take our patients.
I spoke to Blake Conwell, and we got one of the CSI guys down from Cessnock, my name is Scott Everingham, to take charge of setting up the field hospital. And even at that point, the field hospital wasn't the only thing we were talking about. Like, we were even considering, or it was being considered, and we were looking at options for portable morgues, as in shipping containers that were refrigerated. And I remember sitting there late one night just having a conversation with the people that were there and going, this is where, whoever thought this would happen like this?
And another early decision, I think it was in April of 2020, was the introduction of a quarantine period for fresh inmates. And we always knew it was people coming into our centres, whether they were inmates, staff, contractors, that were our highest risk. The vectors of concern, as they were once impersonally known as. So quarantine coming in, this was predating vaccines. There was no vaccines to be heard of, let alone anything coming along anytime soon. And we needed to protect our existing inmates.
One of the first things that we did, and it was Kevin Cochrane and myself did very early on, is we did virtual meetings with the inmates, or patients as we call them, in every centre. And we did that across New South Wales, and we sat with them and we spoke to them about what we were going to have to do with isolations, with 14 days. We talked to them about their phone calls and how to access that. And I think that really started a really good collaboration between the inmate population and ourselves. The staff, probably the most I got from the staff in the early days from our health staff was concern about the restrictions that we were putting in place, and they just challenged us, each other every day, were they the right thing to do? We were isolating people for 14 days in the early days up front, and that was a hard thing for our staff to do, because we tend to fight for human rights, we tend to fight for people having access, and we were sort of taking that away in a way. Sometimes from a health perspective, and the health advice has not necessarily been what people have wanted to hear. So it's really having enough evidence, having some really good data behind you about why you're advising what you're advising, and because when we're advising to lock down a centre or to isolate somebody, corrective services have to do that, and it's not an easy thing to do. So
I think for the prison setting in particular, it was so different. I don't think, unless you work in the system, that anybody really understands the complexities, and the complexities were just coming at us all the time from, areas being taken out because the food wasn't going to be supplied across the state to feed prisoners, patients, the industries, all of those things. You're like, oh my God, it was like a tsunami. So I think, really trying to be agile, be responsive. I think, as Wendy was saying there was times that we didn't agree. Sometimes, corrective services would be, but we can't do that. And I'm like, but you have to. But we can't. But you have to. So it was very much a push me, pull me situation at times. And then we would try and negotiate and work out a compromise, and between both organisations. And that's always a very delicate balance in the sense that security versus health.
Traditionally, things have been slow, and there's no great rush to make decisions, and change doesn't have to be implemented in a as fast-paced sort of way. Whereas, as relentless as this has been, is we didn't have that luxury. We couldn't go and form a subcommittee and have a large consultative group.
One thing I will say, and what have we learned? We all stopped watching the news, and we all stopped reading papers. And I just, it was really interesting, all of us. And I think it was just to see the pandemic played out in the media. And not be able to really, I was shouting at the television sometimes because it was just such scaremongering and the hype and things. And I think people forget that when you've got a loved one in prison, you can't see them, you can't check, you don't know, and you're hearing this on the television and things. And it was so hurtful to the families and the carers of the prisoners and the inmates, but also the prisoners knew that's what their family were hearing.
The group that were there for the first 3 to 6 months, the amount of work and stress and everything that everyone was under, because we're getting everything from around the state. We're like the focus point, as well as having to answer the phone calls to the commissioners and assistant commissioners about things going either rightly or wrongly in various areas. I hope that sort of gets captured somewhere, the great work those people did for the initial stand-up of it, because no one knew what they were doing. It was, and I can say it now, but we got plenty of criticism too from people in the field that we didn't know what we were doing and all the rest of it. And yet, at the end of the day, I remember having a conversation with quite a few people saying they're 100% right, but no one would know what they're doing. No one's going to step in and go, right, step 1, 2, 3, this is how we go.
So we, very early on in the epidemic, the government responded very positively and favourably to a suggestion that we created, which was to utilise the authority of the Commissioner, which is quite unprecedented, to release people from custody if there was a good order and security or public health. And we'd seen it in use in a number of other jurisdictions where they had to let out very large numbers of people immediately. The pandemic was out of control at that stage. And in some jurisdictions, particularly developing countries, that had to let out large numbers of people from jail because they had no means of actually managing the disease.
Initially, we were just quarantining. Everybody who came in that day could quarantine together. And, if one got COVID, well, the rest of them get COVID, but that's fine. And then we, as it became worse with much more infectious, then we started moving to a single cell quarantine, which was really onerous, and we put that in place right across the system.
Social visits came to a stop, and the inmates' ability to interact was limited. There was occasions where we had to stop a lot of movements in the centre in order to minimise any potential risk of any virus spreading. So their social outlook was impacted considerably during certain periods of the COVID outbreak. So we had to make sure that as correctional officers that we continued to engage with them and provide them opportunity to ensure that they were stimulated, whilst in custody.
But I think, the other good thing about our response was that we really focused the positive cases. This is focused all the positive cases in, 2 centres, which is Silverwater Women's and the Metropolitan Remand and Reception Centre. So we could really, develop a sense of excellence amongst the staff there in terms of protocols and compliance with PPE. And even now, you go out there. I was out there today at both those centres, and it's just remarkable. Even now, after all these years of having to do this, the staff are still doing such a magnificent job.
If we had a known COVID positive inmate, they're the only one transported in that vehicle. So that's how we were doing business, just one-on-one in the truck, and they would come to the centre, and then there was a whole process in place of getting them off the truck and getting them into the cell they needed to go to. So
we get fresh custodies coming through our door every single day. So that was identified that was likely to be the source of transmission. So the patients from the community coming in were going to be the way that we spread it within the jail. So to mitigate that risk, Population Health and the Command Post decided that we would be quarantining those fresh custodies. So the fresh custodies would come through and they would be quarantined for a period at that time was 14 days. And then we would test them. So we would do a PCR, which is routine in the community as well, to make sure that they didn't have COVID, and then we would release them into the general population.
What we did need to do right through 2020, we had more serious and critical incidents during that year than I'd seen in the previous 30 years of my career. So SOG were extremely busy in responding to critical incidents in that first year. In my view, what it really brought home was obviously the amount of contraband that was coming into our centres via visits. So that in itself is something we've worked hard to come up with some additional strategies for, but I think it always just goes to show that it's clearly an avenue where a significant amount of contraband was coming in. So as that dried up, we then changed tax, and that's when we started to see a lot more coming in through the mail, such as mail addressed from a legal entity, and having particularly Bupe. But that was what led to a lot of the incidents in 2020.
The first 6 months was a blur, and then upon arriving at the MRRC, even that's, I think, as if anything, sped up time even more, because now it's not just about COVID, it's about also the rest of the centre as well. With over 500 staff and bed capacity of 1,500 on top of this, I think it'd be busy enough anyway, but having this added complexity, let's call it, over the top, definitely. No, that's probably the grand takeaway, that time does go so fast.
So in responding to COVID and in managing risk, we actually suspended a number of activities temporarily. So we suspended community service work and we suspended face-to-face programs. But what we found is that with phone reporting, offenders quite unexpectedly responded really positively. And we believe it's because the stigma of actually attending a community corrections office and having to see an officer face-to-face reduced for them. They were more comfortable in their home environment and they were more able to open up and talk quite openly about how they were managing in responding to COVID and the changing situation.
I'm not going to say people became complacent, but the community definitely didn't take the precautions that were very early on in the piece suggested. And as a result of that, as Adam quite kindly stated, some of our patients don't follow the rules, and that's why they end up in custody. So we did have patients who weren't compliant with the public health order, which did raise issues with us when they came into, because they weren't compliant with PPE. They believed that it was, like a conspiracy. And so we not only deal with patients who break the law, but we have patients who are really medically and mentally unwell, which adds another layer of complexity when dealing with them, particularly if they're COVID positive.
You know, we had inmates going out into the community every day. So when COVID hit, the challenge there was we were letting down, in the initial stages, we felt like we were letting down employers who'd been very, you know, loyal to corrective services in terms of being long-term members of the works release community. And that was difficult because it was obviously not decisions we took lightly, but just the risks in the community at that point in time meant that we needed to stop those inmates going out and potentially bringing that back into the correctional centres.
Nothing was really happening of real huge note either in the community or corrective services. I think his words were, the command post just looks after itself, you won't have to do anything. And then Delta hit, and I've been there ever since. So we had our first true Delta case a week later, and that was in Bathurst. They kind of came, those first few cases came in drips and drabs, and then before we knew it, we were seeing multiple cases per day, per week, and that's when we saw the peak, and we started to see some significant outbreaks across the state.
Yep, so if an inmate tests positive, our first goal is to make sure that doesn't spread. So we need to isolate that inmate, and we need to make sure that any other inmate that might have been around that offender or any staff, that we treat those with the same
In the early
concerns.
few weeks of those first few cases, we were here till 1 in the morning, contact tracing. You know, as a team, we just didn't want to go home until we'd contacted every single person in every single location. It was a really committed team, you know, there were a lot of long hours. I mean, I remember driving out of here at midnight, 1, 2 a.m. for those first few weeks. And I think then we realised we needed to grow really quickly, because while this was 1 or 2 cases, what would we do if we got 5 cases a day? And so we expanded our team, but we also changed the way in which we did business. So we had an off-site contact tracing team. So I think we were the only organisation that I know in Australia that did that for their work environments. We had people who were off on, you know, work-related injuries, or people who were working from home who had capacity. And we had, I think at the peak, 100 people sitting at home trained. So it meant that our staff could go home at a reasonable hour, get some sleep, come back refreshed. And it completely changed the way in which we managed the pandemic in the early days.
Yeah, so generally your fresh custody will arrive in a court location, or one of our Laurel, Surrey Hills, for example, and go through a screening process on site where they're assessed for any symptoms. They're asked a number of questions to identify whether or not they're symptomatic, or they've had COVID previously, or if they're, sometimes when they come in, they'll actually be identified already as COVID positive. So for the ones that aren't, they go through that initial screening process. They're isolated and they're sent to the MRRC for a period of time, 10 days, which it currently is. It used to be 14 days, a 14-day quarantine period. At the moment, it's 10 days. So they travel to MRRC, they complete their 10 days. They go through a testing and isolation regime at that location. It could be MRRC or Silverwater Women's, because they're our 2 isolation hubs. Once they finish their 10 days, they're cleared by the local health team and population health, and they go about their business, back into the system.
Another issue that I think we found was the negative media around the vaccination. That, I think, had a very large impact on the vaccination rates of inmates and staff.
A lot of people think that we should be able to force patients to get vaccinations. You can't do that. They have choices just like anybody else. So you can try and educate and guide the patients into wanting a vaccination, but ultimately you can't force them.
Yeah, I think understandably there was some concerns as to exactly what was entailed in getting the vaccination, what was in it. You know, it was a fairly sudden event that happened from the time that the coronavirus was first identified as being in Australia to that point where it was determined that we need to be vaccinated against it. So I guess giving staff the confidence that what was being offered was safe and was needed, particularly for us in our roles, and the importance of being vaccinated.
You know, we've still got a significant proportion of the inmate population that refuse to get vaccinated. We're up around maybe 8 or 9%. of the inmate population. Of course, all officers have to be vaccinated. They can't come to work. So that's been another real issue for us. The impact of Delta on a lot of staff was quite significant. And, some staff haven't even returned to work as a result of, getting infected with this Delta variant and the impact it's had on their health. So it's been, pretty tragic from that perspective. And, I hope that they do get better, but, it's really impacted on their lung function and just their general health and well-being.
Some of the big changes that I think have been beneficial is, with the courts shutting down and not having as many people physically required to go to court, is the rollout of the AVL tablets across the centre, which has enabled the courts still to see and hear inmates during their legal matters. So we've put in the best part of, I think it's 18 signal boosters for these tablets around the centre.
And the main challenges we had really was in the network capacity. The opportunities that it gave us, though, was the introduction of video visits, which was a very, very big thing for corrective services. So whilst prior to COVID, we were struggling on how to apply this sort of business to operational areas and looking at all the different functions that had to happen. Fortunately, we'd done a lot of groundwork there, so when lockdown happened, we were able to get video visits up and running within about 3 weeks after we shut down in-person visits. And up to date, we've done now around about 375,000 visits via video conferencing for families.
So people were initially concerned and sceptical about giving inmates access to devices that previously had been completely banned from prisons, and all of a sudden we were rolling out hundreds of these devices in all jails and allowing prisoners to use them to communicate with their families with some level of supervision, but certainly not the same level of supervision you might have in a face-to-face visiting environment in a prison. But people saw these immediate benefits. The first benefit was that the interactions with family members, which can be very stressful for everyone, the family member and the staff, was significantly reduced through that mechanism. So that was at arm's length from the prison officers who were supervising the visit. But the opportunities for introducing contraband were dramatically reduced to the extent that the drug supply in jails almost completely dried up in some instances, causing its own set of consequences. But staff then responded very, very favourably to that. They saw the benefit of it. They saw what a calming impact it had on prisoners. So a bit of technology. I'd been planning to roll out technology like that for some time. And in our preliminary work, we were planning for that. We anticipated incredible staff resistance to it. And having had this experience, staff were completely socialised very quickly to this new approach to managing visits and saw these great benefits from it. We did a survey of the families. Several thousand families responded and several hundred staff, and the staff were overwhelmingly supportive of it and wanted that technology to stay beyond that time.
There was quite an emotional time for a lot of people. What we discovered was that the use of video conferencing had a real personal touch. So whilst we knew what the mechanics would be and we knew what we had to do from a procedural point of view, it was about how inmates reacted to that and what they did. So for example, we would have a lot of families that were video conferencing from home, and they would actually walk around with their device and show the people in prison the new bed that they're sleeping in as a child, the family animal, how it's grown up since Dad's sort of not with them at the moment. So there were these massive links that we just did not realise would happen. And there was this connection with families and people in jail because of this ability to show the inmate into their life rather than just discussing this over a cold table within a visiting section.
Where we have AVLs all day Saturday and we're back to contacts for an hour, 4 sessions a day on a Sunday. So COVID's had a huge impact on our visits at Lithgow Correctional Centre. As you can see in the background, we've got tables and chairs covered up. So this is so that we know and can abide by our square meterage rule for the centre. On some of the tables, we have AVL frames where the tablet will sit into the frame of a weekend. The inmates can't touch it. They just sit there and talk to their families for 27 minutes. We have a break in between every visit, AVL and contact, and one of our inmate sweepers is then required to do a COVID clean, and he wipes down all the tables and the chairs, all the tablets, ready for the next visit. With our AVL visits, the inmates actually love it. They get to see their families that they haven't seen for years. As you can imagine, Lithgow is in a remote area, and it can take several hours for a family member to travel for 1 hour visit. The AVLs, they can have their visit every Saturday and or Sunday. They get to see their family, they get to see their house, they get to see their animals might run across on the AVL tablet. So they love it. The visitors love it as well because it saves them a lot of money and time, so they don't have to travel up for their hour visit. They can have their contact visit. So everyone loves it.
We had our first tests on site in August, which is right when the pandemic hit us in terms of Delta. Other agencies were scrambling for those tests. We had our supply in place, and to date we're almost at 500,000 tests.
And we've certainly led the New South Wales public sector. We were the trial agency for the use of rapid antigen screens amongst staff. And we're also a trial for New South Wales Health to work out the efficacy of these rapid antigen screens, because we were able to test every inmate coming in. At one stage we were testing every inmate with a RAS and then immediately testing with a PCR as well. So we were able to work out how effective and accurate these tests were with real-time data, which wasn't coming from anywhere else in the state. So we've played, I think, a significant role in public health response in New South Wales through corrective services.
Initial build-up of RAS as well was the understanding around the Ruby Princess and the detrimental impacts of COVID on the cruise ships, and a lot of discussion as well around the similarities between those type of confined spaces, and also the impacts of other jails around the world. Part of that initial phase as well was rapid testing was only approved for use by medical practitioners, so those with APRA registration. And we faced a significant challenge in corrective services in that we didn't have enough of those people and enough coverage across the state to be able to support the level of testing that was required at the time, and then also increase from there. So there was special provisions provided by the TGA where we were able to get health practitioners, Justice Health, to train our staff, non-clinical staff, in being able to test for under supervised conditions, and then further on using those staff to be able to test at their local sites. Corrective Services, I think at the time, were the only organisation approved to have non-clinical staff to be able to do that testing.
You know, just to give you some idea of how much effort we've put into this, you know, we've got the number of staff that we've got assigned to COVID duties over and above our normal staffing establishment is over $40 million worth of staff. So it is a significant number of staff. So, you know, something around about the 370 FTEs that we are devoting on a daily basis to COVID positions over and above what you would normally see working in a correctional centre. Well, that's put enormous stress on it. When you combine that with everybody who's been going off and isolating or getting COVID, you know, and those numbers are significant now, as well as you know, normal attrition rates in them. We haven't been able to do much training as well. You know, it's significant problems with you know, trying to staff up facilities around the place and get inmates out, you know, to exercise and things like that. So it's been a real challenge.
The staffing situation today, you just look at today's roster, we got 76 positions on today's roster. Out of the 76 positions, we are short 11 staff on sick leave, 10 staff on pandemic leave, and 10 staff on workers' compensation, which we cannot backfill because there's no casuals to backfill those positions, and that's what leaves the centre locked down.
Corrective Services have been extremely supportive as to what we've requested. And you know, we've all had challenges, we've all had bad days, we've all had stressful days, but I think it's really brought the two key stakeholders closer together and strengthened our relationship.
You know, we almost have as a team like a sixth sense for when things are going to take off, and we certainly felt that in the head. You know, we had the peak of Delta, we came down the other side of it, October, November, felt, we don't use the Q word, but it felt a bit quieter than it had been. We spent that time to really have a look at what we would do if a new strain was to come upon us. Of course that did, and it did with gusto. So I think just before Christmas, we were sitting on 96 staff who were positive. I think our last reporting period before the Christmas period was the 21st of December, from memory. In just 2 weeks, we had seen that go up to almost 600 staff.
Over 200, I think that peaked at 208 staff isolating at any one time. The pressures didn't change. It still had to operate as a remand centre. Hospital escorts still had to go out. I think at one point during all that, I think we had 11 hospital escorts as well. So we're looking at reverting to 12-hour shifts for hospital escorts. And literally a reduction in all services apart from the bare essentials there, the feeding, the medication, the absolute bare basics. At that point, we've just recently let them go back to their main centres. We had a team from around the state come down. I think it was 13 correctional officers from other centres come down and assist.
So Lithgow does produce some products for private enterprise, which inmates manufacture here. And obviously some of those businesses, you know, closed down or shut over the COVID period. And I think another impact was potentially the inability to import products from overseas, given the restrictions that were put in place on an international standard. Other elements of our business probably prospered a little better. So here at Lithgow we do make hospital products in the forms of gowns and things like that. So obviously hospitals were very, very busy during that period. So that part of our business had a little bit of growth. However, it was always a little bit impeded by the fact that we had a lot of difficulty getting materials into the area.
Looking at the depletion of my colleagues, corrective services and nursing, it was an accumulation. Everyone was tired, and it snowballs, and it was like I was never leaving my computer. So the amount of data and reporting I had to do on a daily basis, I wasn't able to engage with my team. And so personally, that was the lowest period for me.
With restricted staff numbers, and particularly during those periods where we're required to have restricted movements, we couldn't get the offenders to those education programs for the training. The other side is that we had a lot of issues in actually getting outside presenters into the centre. The restrictions put in place limited a lot of external providers from coming into correctional centres to provide those training opportunities. So we had to be a little bit creative about the things that we can do to keep the inmates engaged and entertained. And a lot of that was around employment. And the one thing the COVID did do for us is it allowed us to actually create some additional employment for inmates around COVID cleaning. So a lot of offenders were actually employed to go around the centre to various locations and actually clean the environment itself.
And we've been able to manage some significant outbreaks and get them back down to zero again, which was quite remarkable. I know other jurisdictions haven't had this sort of issue, and we've been incredibly fortunate here because we had, you know, thousands of beds that we could start to employ for quarantine. Other agencies around Australia haven't been able to do that. They've just had to manage them in situ. And in fact, I think one particular prison in one jurisdiction, I think, you know, probably 90% of the inmates went positive. But so they just quarantined the negative inmates and let the positives just wander about freely.
I think, you know, they're trying to battle with like health requirements, you know, operational changes, you know, changes in policy and in commissioners' instructions that are ongoing, and I think it's extremely stressful. I think the centre managers and our team out in the field are doing an amazing job, but it's certainly affecting them, their mental health. You know, the assaults in the centres would definitely have increased. The incidents increased. You know, some centres have capacity to isolate inmates for a period of time with amenities such as, you know, your showers or your bathrooms, etc., in cell, and some don't. And those centres, you really feel for them because they're constantly on a hamster wheel of isolation for inmates. And when you're locked away in a little concrete block for extended periods of time, the levels of tension rise between inmates and staff, and you know they're out there battling that every day.
An increase in cell fires, we've had an increase in staff assaults, we've had a sharp increase with liquids being thrown on staff.
Spitting.
Spitting incidents have increased. There was a serious incident over the weekend where an inmate managed to rip off a piece of metal from within the cell and attempt to use it as a projectile against staff when they were issuing meals.
Something that has really surprised me is just how fantastic our teams on the ground are. They are on the front line wearing the PPE for the full duration of their shifts in hot temperatures, dealing with challenging clients and challenging situations. COVID has just added an extra layer of complexity for all of those teams, and they should be absolutely commended for all of their work throughout this. I just can't fault it. Throughout the pandemic, we've had multiple outbreak sites, but we haven't seen it rip through the system in the way that we feared, and that is really down to the people on the ground wearing the PPE and complying with those Commissioner's instructions and listening to and having trust in the command post. And something else that often gets overlooked as well is that the inmates have played such an important role in this. I don't think our jails have been cleaner. Every touch point, every hard surface, they've done their part in keeping their part of the world as clean and as sanitised as possible by wearing the PPE and practicing good hand hygiene. And all the extra cleaning regimes that have gone into that have certainly played their part. And it's been tough. It's been tough to do your time in New South Wales at this time. We've only just brought back in-person social visits. People are finally seeing their children again. If you're a close contact, you're having to confine in your cell for up to 10 days. These have been really tough conditions for people, and jail is hard enough without all of those on top.
In the initial stages, we were meticulous in terms of our hygiene standards and our protocols in our offices. So we were doing temperature testing, we were doing social distancing, and staff were constantly ensuring that the hygiene standards were complied with. So initially there was no COVID transmission in any community corrections workplace. And it's only been in the last several months, once a lot of the restrictions have been lifted and people have been coming back into our work locations, that COVID has appeared in our workplaces, and a number of our staff have needed to take time off to manage the effects of COVID. Community corrections is quite fortunate in a lot of our workplaces. We can afford people the opportunity to work from home. So in the event that someone is a close contact of someone with COVID, we can change the working arrangements so that they can perform work in the home environment for the period of their isolation.
I think if people are dealing with a similar thing, I hope they don't in 10, 20, 30 years, is the importance of the absolute basics of the PPE, the social distancing. It's all the messages that we've sort of had, and to attempt to think a couple of steps ahead. So some of the things that we've learnt from this is the numbers, and this is, and correct me if I'm wrong with your experience, the numbers in the community spike, and it's a week and a half to 2 weeks delay before it really impacts on us. So it's not like we're just in line with the community. So again, that gives you some preparation time. So we did things like we changed inmates around, we moved inmate cohorts out of the MRRC when the community numbers sort of spiked. So no, that's probably the grand takeaway, that time does go so fast. Yeah, I don't know where the last 2 years has gone, to be honest. It's thoroughly disappeared. I'm not going to lie, I think it's everyone's pretty much over it in the centre.
And tired. Everyone's tired.
That's right. At one point we had over 200 staff off isolating as a result of either close contacts, either in the workplace or out of the workplace. So that takes its toll, as in we have to get the few remaining staff to work the extended hours.
And step up and guide the others.
Absolutely.
And we had a similar thing happen where 50% of our workforce was off. So we were doing crazy hours. We had staff from other centres coming across, which was really good, but they didn't know the centre. So we really had to rely on the staff that were left. And they, like Adam said, they were tired and they were trying their very best to do what they could, but there's only so much you can do.
So when we were running in-person visits prior to COVID, we were doing around about 4,500 to 5,000 visits per week in person. At the height of COVID, we were running 5,000 video visits per week. So whilst we've had one or two issues and we identify that and we then fix those issues, I think that video conferencing will always have a place within business, within corrective services, not only the core business being legals and courts, but also the introduction of family video visits, which just allows that further contact.
I would actually say we're feeling the impacts of COVID more now than potentially earlier. We did have a few outbreaks, but because the community settings at those earlier points in time were so strict with the lockdowns, with the, the isolation for the 14 days, etc. So we got through COVID. In all honesty, CSNSW were like stars. We got through that situation very, very well. It was very difficult and we had a lot of measures in place to mitigate risk. But now we've kind of opened up. We've removed a lot of those settings, such as, the full PPE and the isolation and all of those things combined have led us to a place where in the community there is still a lot of COVID and influenza going around. So the actual impacts to our staffing profile, I would say, have been felt more in the last few weeks than in the previous 2 years.
So we have updated our service delivery standards, and we've also updated our offender management approach to incorporate delivery of interventions and one-on-one supervision via phone as part of our routine practice. So it's actually been incorporated into our new service delivery standards.
It's been tough, and just all standing together, I think, is the main thing, and putting our heads together. There's been a few, those late night calls, those early morning things. Let's sleep on it. Let's get through it. And sometimes you're just really glad that you got through that 24 hours, and nobody got hurt.
We have had over 3,600 prisoners with COVID. A large number of them had COVID when they came in from the community, and some of them acquired the disease in custody. But over the course of the epidemic, we've seen with various variants, the infectivity has gone up multiple times, and yet we've managed to effectively baseline the rate of, stabilise the rate of infection. And I think we only did that by having a really collaborative process, by responding very positively to advice and being quite agile in our response. So we would be challenged with something and we'd put in place something that would be given effect to within 24 hours. And to do that, we had to do it in collaboration with our colleagues in Justice Health, whether it be testing routines, taking advice on the best public health response. And Justice Health have been our partners in this from the very outside. We worked hand in hand. They have had people embedded in the command post through the epidemic. There have been multiple daily meetings with a lot of discipline required amongst all of the staff working in this, but basically a commitment to working 24 hours a day, 7 days a week.
And so there's some significant foresight in that engaging with some mathematical modelers to guide the public health control measures. And really because of that, if you look at the timelines of community-based outbreaks and the interventions put in place in the prisons, definitely a leader of the pack in the prison sector nationally and internationally in getting those measures in place, demonstrating their utility, working out how they should be prioritised, and now looking forward into heading slowly towards the post-COVID era.
One of the things that I'm proudest most of all with our staff at Corrective Services is the fact that they've had to come to work every single day to do a very, very difficult job in a difficult environment, which is every day we come to work. And on top of that, they've had to manage their COVID situations in their personal lives. That's their kids not going to school, it's mum potentially not having a job because the business has gone broke, and then they've got to manage all that and then come here and manage all our issues within our environment here. That's the donning of PPE every day, it's the managing the cleaning regimes, it's dealing with the inmates who have lost their contact with their families on the weekend. It's been a very, very stressful period for everybody, and I've got to say, across the whole organisation, we've rallied together and really done a fantastic job.
How about I don't ever want to do this again?
From my perspective, it was really important to capture everything we've done. So we've been doing a lessons learnt process, capturing all of the things we've done, and we've been writing it up. We've been not just being satisfied with the fact that we didn't have serious consequences, we've engaged with external people to do really deep dives into the molecular epidemiology of the disease in a number of the breakout areas. It's happened, so we're not going to stop it from happening in that location again, but we might be able to understand in future how the vectors operate in jail, what the things are that need to be brought under control very quickly, and we've captured that.
Get sleep when you can, because it's grueling, and the self-care that I think is required in terms of resilience for my team. You know, it is something that we overlook, I think, a little bit. We get caught up in the adrenaline and the excitement, but this has been a long game. I think we thought this was going to be a short, sharp game. This has actually been a long game. So if I could give advice to myself back then, is to keep a little bit in the tank.
The advice is, watch this video. And that's exactly what I've been saying to people. We're making this video so, you know, COVID 45, they can look back and go, what the hell did they do back then?